Question 1. What factors determine the appropriate application of a new clinical trial finding in patient care, considering the principles of evidence-based medicine within the United States medical regulatory framework? Option A. The ease with which the study's abstract can be understood and its availability in widely circulated medical journals. Option B. The methodological rigor of the study, the generalizability of its findings to the patient's specific population, and the patient's individual values and circumstances. Option C. The alignment of the findings with the physician's pre-existing clinical experience and established treatment protocols. Option D. The recency of the publication and the number of authors listed on the study. Correct answer is B. The methodological rigor of the study, the generalizability of its findings to the patient's specific population, and the patient's individual values and circumstances. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a physician to critically evaluate the quality and applicability of medical evidence to a specific patient's clinical situation. The physician must move beyond simply accepting published findings to discerning their relevance and reliability, balancing patient autonomy with the best available scientific knowledge. This demands a nuanced understanding of research methodology and its limitations. Correct approach analysis. The correct approach represents best professional practice because it prioritizes the integration of high-quality, relevant evidence with individual patient values and circumstances. This aligns with the core principles of evidence-based medicine, EBM, as taught and expected in U.S. medical education and practice, emphasizing the judicious use of current best evidence in making decisions about the care of individual patients. It acknowledges that a single study, especially one with methodological flaws or from a population dissimilar to the patient, may not be sufficient to guide clinical decisions. The process involves assessing the strength of evidence, considering the patient's specific condition, comorbidities, preferences, and the potential benefits and harms of different interventions. This approach is ethically sound, respecting patient autonomy and beneficence. Incorrect approaches analysis. One incorrect approach fails by relying solely on the most recent publication without critically appraising its methodology or relevance. This violates EBM principles by overlooking potential biases, confounding factors, or applicability issues, potentially leading to suboptimal or harmful patient care. Ethically, it neglects the physician's duty to ensure that treatment decisions are based on sound evidence and are tailored to the individual. Another incorrect approach is to dismiss evidence that contradicts personal clinical experience or established practice without a thorough, objective evaluation. This demonstrates a lack of intellectual humility and a resistance to scientific advancement, which is contrary to the dynamic nature of medical knowledge. It can lead to the perpetuation of outdated or ineffective treatments, failing the ethical obligation to provide the best possible care. A further incorrect approach involves prioritizing the ease of access to information over its scientific rigor or clinical applicability. While efficiency is important, it should not come at the expense of evidence quality. Relying on readily available but potentially weak evidence can lead to misinformed decisions, undermining the physician's responsibility to act in the patient's best interest. Professional reasoning. Professionals should employ a systematic approach to EBM. This involves formulating a clear clinical question, searching for the best available evidence, critically appraising the evidence for validity, reliability, and applicability, integrating the appraised evidence with clinical expertise and patient values, and evaluating the effectiveness of the decision. This iterative process ensures that clinical decisions are informed, ethical, and patient-centered, adhering to the standards of practice expected within the U.S. medical regulatory framework. Question 2. When evaluating a biopsy specimen from a patient presenting with a non-healing lesion, a physician observes microscopic structures characterized by concentric layers of squamous cells with a central core of keratin. Which of the following interpretations most accurately reflects the pathological significance of these findings? Option A. The findings are consistent with a localized inflammatory response. Option B. The presence of keratin pearls indicates a squamous cell carcinoma. Option C. The tissue exhibits benign hyperplasia of squamous epithelium. Option D. The structures represent a normal variant of keratinization. The correct answer is B. The presence of keratin pearls indicates a squamous cell carcinoma. Explanation. Scenario analysis. This scenario presents a challenge in differentiating between normal physiological changes and pathological processes at the cellular level, which is fundamental for accurate diagnosis and subsequent patient management. The physician must rely on their understanding of normal tissue histology to identify deviations indicative of disease, ensuring appropriate treatment is initiated. Correct approach analysis. Identifying the presence of keratin pearls within the tissue sample is the most accurate approach. Keratin pearls are a hallmark histological feature of squamous cell carcinoma, representing abnormal keratinization. Recognizing this specific microscopic finding directly points to a malignant neoplastic process, guiding further diagnostic steps and treatment planning in accordance with established oncological protocols and the principles of diagnostic pathology as understood within the U.S. medical framework. Incorrect approaches analysis. Attributing the findings solely to inflammation or infection is a significant diagnostic error. While inflammation can cause cellular changes, it does not typically result in the formation of keratin pearls. Misinterpreting these findings could lead to delayed or inappropriate treatment, potentially allowing a malignancy to progress unchecked, violating the ethical obligation to provide competent medical care and the regulatory expectation of accurate diagnosis. Classifying the tissue as benign hyperplasia without further microscopic examination is also incorrect. Benign hyperplasia involves an increase in the number of cells, but it generally maintains normal cellular architecture and differentiation. The presence of keratin pearls signifies a loss of normal differentiation and uncontrolled growth, characteristic of malignancy, not benign proliferation. Failing to identify malignancy has severe regulatory and ethical implications, including potential malpractice, including that the findings represent a normal variant of keratinization, without considering the context of the patient's presentation or the specific morphology of the structures, is a failure of critical analysis. Normal keratinization occurs in specific locations and has a distinct appearance. The formation of organized, concentric layers of squamous cells with a central keratin core, keratin pearl, is a pathological finding, not a normal variant. This oversight demonstrates a lack of thoroughness in diagnostic reasoning, which is a cornerstone of professional medical practice and subject to regulatory oversight. Professional reasoning. Professionals should approach tissue evaluation with a systematic process. This involves correlating gross findings with patient history and clinical presentation, followed by meticulous microscopic examination. When encountering unusual or potentially pathological structures, such as keratin pearls, the professional must consult established diagnostic criteria and, if necessary, seek expert consultation, e.g., from a pathologist. This ensures diagnostic accuracy, adherence to best practices, and compliance with regulatory standards for patient care. Question 3. Quality control measures reveal that a 65-year-old male with a history of chronic kidney disease and recent gastrointestinal bleeding presents with fatigue, edema, and confusion. Laboratory results show a blood urea nitrogen BUN of 55 mg/dl, serum creatinine of 2.5 mg/dl, and serum albumin of 2.8 g/dl. His urine output has been adequate. Which of the following is the most likely primary contributor to the patient's hypoalbuminemia and elevated BUN and creatinine, considering the interplay of his conditions? Option A. Excessive protein lost through the gastrointestinal tract from bleeding, leading to a negative nitrogen balance and subsequent decreased albumin synthesis. Option B. Acute tubular necrosis secondary to hypovolemia from gastrointestinal bleeding, causing impaired urea excretion and protein catabolism. Option C. Impaired hepatic synthesis of albumin due to chronic disease and reduced protein intake, compounded by renal dysfunction leading to nitrogenous waste accumulation. Option D. Protein-losing enteropathy unrelated to the recent bleeding event, resulting in significant albumin depletion and renal overload. The correct answer is C. Impaired hepatic synthesis of albumin due to chronic disease and reduced protein intake, compounded by renal dysfunction leading to nitrogenous waste accumulation. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for misinterpreting laboratory findings related to protein metabolism in a patient with a complex medical history. The physician must integrate multiple pieces of information, including patient symptoms, laboratory results, and underlying conditions, to arrive at an accurate diagnosis and treatment plan. Failure to do so could lead to delayed or incorrect management, impacting patient outcomes. The challenge lies in discerning the most likely cause of the observed abnormalities within the context of the U.S. healthcare regulatory framework, which emphasizes evidence-based medicine and patient safety. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's clinical presentation in conjunction with the laboratory data, considering the known pathophysiology of protein metabolism. Specifically, recognizing that elevated BUN and creatinine, coupled with hypoalbuminemia, in a patient with a history of chronic kidney disease and recent gastrointestinal bleeding, strongly suggests impaired protein metabolism due to both reduced intake and increased loss/catabolism. This approach aligns with the U.S. medical licensing examination's emphasis on clinical reasoning and the application of scientific knowledge to patient care. It reflects best professional practice by prioritizing a comprehensive understanding of the patient's condition and the underlying biological processes, adhering to the principles of diagnostic accuracy and appropriate patient management, as expected within the U.S. medical system. Incorrect approaches analysis. One incorrect approach would be to solely focus on the gastrointestinal bleeding as the cause of hypoalbuminemia, neglecting the concurrent elevation in BUN and creatinine. This would be a regulatory and ethical failure because it represents an incomplete diagnostic workup, potentially overlooking the contribution of renal dysfunction to the overall protein imbalance. The U.S. regulatory framework, through bodies like the FDA and CMS, mandates thorough and accurate diagnosis. Another incorrect approach would be to attribute the elevated BUN and creatinine solely to dehydration from the bleeding, without adequately considering the impact on protein metabolism and the potential for chronic kidney disease exacerbation. This is a failure to apply comprehensive physiological understanding and could lead to inappropriate fluid management and a lack of targeted treatment for the underlying renal issue, violating the ethical obligation to provide competent care. A third incorrect approach might be to immediately initiate aggressive protein supplementation without a clear understanding of the patient's renal capacity to excrete nitrogenous waste products, which could worsen uremia and is contrary to evidence-based guidelines for managing renal insufficiency. This would be a failure to adhere to established medical protocols and could be considered negligent care under U.S. medical malpractice law. Professional reasoning. Professionals should employ a structured decision-making process that begins with a thorough review of the patient's history and presenting symptoms. This is followed by a critical assessment of all available laboratory data, considering potential confounding factors and the interplay between different physiological systems. The next step involves formulating a differential diagnosis, weighing the likelihood of various etiologies based on the integrated clinical and laboratory findings. Finally, the professional should select the diagnostic and therapeutic interventions that are most evidence-based, patient-centered, and aligned with current medical standards and regulatory requirements within the United States. Question 4. The control framework reveals that a patient presents with acute, unilateral limb swelling and pain, accompanied by a palpable but non-pulsatile mass in the proximal thigh. Considering common anatomical variations and their potential clinical manifestations, which of the following vascular structures, if abnormally positioned or dilated, would be the most likely cause of these findings? Option A. Tortuosity of the great saphenous vein. Option B. Congenital arteriovenous fistula in the popliteal fossa. Option C. Aneurysmal dilation of the superficial femoral artery. Option D. Aberrant origin of the profunda femoris artery. The correct answer is C. Aneurysmal dilation of the superficial femoral artery. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical nature of vascular anatomy in surgical planning and the potential for life-threatening complications if anatomical variations are not recognized. The physician must integrate detailed anatomical knowledge with clinical presentation to formulate an accurate diagnosis and treatment strategy, highlighting the importance of meticulous observation and differential diagnosis. Correct approach analysis. The correct approach represents best professional practice because it systematically considers the most likely anatomical variations that could explain the patient's symptoms, prioritizing those that are clinically significant and directly related to the observed signs. This aligns with the U.S. medical regulatory framework's emphasis on evidence-based practice, patient safety, and the physician's duty of care to accurately diagnose and manage conditions. It reflects a commitment to thoroughness and a patient-centered approach, ensuring that all plausible explanations are evaluated before settling on a diagnosis. Incorrect approach is analysis. One incorrect approach fails by focusing on a rare anatomical variation without first exhausting more common causes. This deviates from best practice by potentially delaying diagnosis and treatment of a more probable condition, which could be detrimental to patient outcomes and may be considered a breach of the physician's duty to provide timely and appropriate care under U.S. medical standards. Another incorrect approach overlooks a critical anatomical landmark directly implicated by the patient's symptoms. This oversight demonstrates a failure in applying fundamental anatomical knowledge, which is a core competency expected of physicians under U.S. medical licensing requirements. Such a failure could lead to misdiagnosis and inappropriate management, posing a significant risk to patient safety and potentially violating professional conduct guidelines. A further incorrect approach relies solely on imaging findings without correlating them with the patient's clinical presentation and known anatomical variations. While imaging is crucial, its interpretation must be contextualized. A failure to integrate all available information, including the patient's history and physical exam, represents a fragmented approach to patient care, which is contrary to the holistic and comprehensive standards mandated by U.S. medical practice regulations. Professional reasoning. Professionals should approach such scenarios by first establishing a comprehensive differential diagnosis based on the patient's chief complaint and physical findings. This involves recalling and applying foundational knowledge of vascular anatomy, considering common variations and their clinical implications. Next, they should prioritize investigations that will best differentiate between the most likely diagnoses, always keeping patient safety and the potential for serious complications at the forefront of their decision-making. This systematic, evidence-based, and patient-centered approach is the cornerstone of ethical and effective medical practice within the U.S. regulatory framework. Question 5. The assessment process reveals that a new laboratory technician is responsible for the initial identification of tissue samples obtained during a surgical procedure. The technician has been trained on basic histological staining, but has limited experience with complex cellular morphology. Which of the following approaches represents the most appropriate and professionally sound method for tissue identification in this context? Adhering to U.S. medical standards. Option A. The technician performs initial gross examination and then applies a standard H&E stain, with the final identification being based on their interpretation of the stain slide. Option B. The technician prepares the slides with H&E stain and then a board-certified pathologist reviews and makes the definitive identification of the tissue. Option C. The technician relies solely on gross visual characteristics of the fresh tissue to make the initial identification before fixation. Option D. The technician uses a single, specialized immunohistochemical stain that they have been trained on to identify the tissue type. Correct answer is A. The technician performs initial gross examination and then applies a standard H&E stain, with the final identification being based on their interpretation of the stain slide. Explanation. Scenario analysis. This scenario presents a challenge in accurately identifying tissue samples, which is fundamental to diagnosis and treatment planning. Misidentification can lead to incorrect diagnoses, inappropriate therapies, and potentially harmful patient outcomes. The professional challenge lies in ensuring the highest level of accuracy and reliability in a process that requires meticulous attention to detail and adherence to established protocols. Correct approach analysis. The correct approach involves utilizing a combination of established histological staining techniques and microscopic examination by a qualified pathologist. This method is best professional practice because it is the gold standard for tissue identification in the United States medical system. Regulatory bodies like the College of American Pathologists, CAP, and the Clinical Laboratory Improvement Amendments, CLIA, mandate rigorous quality control and proficiency testing for laboratories performing such analyses, ensuring accuracy and patient safety. The pathologist's expertise in interpreting cellular morphology, architectural patterns, and staining characteristics is crucial for definitive identification. Incorrect approach is analysis. One incorrect approach is relying solely on gross visual inspection without microscopic examination. This is professionally unacceptable because gross features can be misleading and lack the cellular-level detail necessary for accurate identification. It violates the principles of good laboratory practice and the standards of care expected in pathology, which are implicitly governed by federal regulations like CLIA that ensure the accuracy and reliability of laboratory testing. Another incorrect approach is using a single, nonspecific stain without corroborating evidence or expert interpretation. This is professionally unacceptable, as it increases the risk of misinterpretation and false positives or negatives. The lack of a comprehensive diagnostic approach, including multiple stains if necessary and pathologist review, fails to meet the standards of diagnostic accuracy required by regulatory oversight and ethical medical practice. A third incorrect approach is outsourcing the primary identification to a technician without pathologist oversight for complex or ambiguous cases. While technicians play a vital role in sample preparation and initial screening, the final diagnostic interpretation, especially for critical tissue identification, must rest with a licensed pathologist. This failure to involve the appropriate level of expertise can lead to diagnostic errors and contravenes the established hierarchy of responsibility and quality assurance in medical laboratories, as enforced by CLIA regulations. Professional reasoning. Professionals should approach tissue identification with a systematic process that prioritizes accuracy and patient safety. This involves understanding the limitations of each diagnostic tool, adhering to established protocols, and ensuring that the final interpretation is performed by a qualified expert. In cases of ambiguity, seeking consultation or employing additional diagnostic modalities is essential. The decision-making process should always be guided by the principles of evidence-based medicine and regulatory compliance, ensuring that patient care is based on the most reliable diagnostic information. Question 6. System analysis indicates a 55-year-old male presents with a routine physical examination revealing an elevated LDL cholesterol level of 190 mg/dl and triglyceride level of 250 mg/dl. His family history is positive for premature coronary artery disease in his father. He reports a generally healthy diet and moderate exercise. Which of the following diagnostic approaches best reflects a comprehensive evaluation of this patient's lipid abnormality? Option A. Initiate statin therapy immediately to lower LDL cholesterol and recheck lipid panel in 6 months. Option B. Advise the patient to strictly adhere to a low-fat diet and increase physical activity, then recheck lipid panel in 3 months. Option C. Order genetic testing for common familial hypercholesterolemia mutations and assess for secondary causes of dyslipidemia, such as hypothyroidism and diabetes. Option D. Focus solely on managing the elevated triglyceride level with fibrate therapy, as this is the primary risk factor for pancreatitis. The correct answer is A. Initiate statin therapy immediately to lower LDL cholesterol and recheck lipid panel in 6 months. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent complexity of lipid metabolism disorders and the potential for misinterpretation of diagnostic information. A physician must integrate a patient's clinical presentation, laboratory findings, and genetic predispositions to formulate an accurate diagnosis and treatment plan. The challenge lies in distinguishing between primary genetic lipid disorders and secondary dyslipidemias caused by other medical conditions or lifestyle factors, which requires a thorough understanding of metabolic pathways and their regulation. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's lipid profile in the context of their overall health status and family history. This includes considering the specific types of lipids elevated, e.g., LDL-C, triglycerides, total cholesterol, the presence of genetic mutations known to affect lipid metabolism, and the potential for secondary causes such as diabetes, hypothyroidism, or renal disease. This comprehensive approach aligns with best professional practice by ensuring a precise diagnosis, which is crucial for tailoring effective therapeutic interventions and preventing long-term cardiovascular complications. Adherence to established diagnostic criteria and guidelines for lipid disorders, as promoted by organizations like the National Cholesterol Education Program, NCEP, and the American Heart Association, AHA, is paramount. Incorrect approaches analysis. An approach that focuses solely on lowering LDL-C without investigating the underlying cause of dyslipidemia is professionally unacceptable. This fails to address potential secondary causes that may require specific management, such as optimizing glycemic control in a diabetic patient or treating hypothyroidism. It also overlooks the possibility of genetic disorders where LDL-C lowering alone might be insufficient or where other lipid abnormalities, e.g., high triglycerides, are equally or more critical to manage. This approach risks incomplete treatment and potential adverse outcomes. Another incorrect approach would be to attribute all dyslipidemia solely to diet and lifestyle, without considering genetic predispositions. While lifestyle factors are significant, many severe lipid disorders have a strong genetic component, e.g., familial hypercholesterolemia. Ignoring genetic factors can lead to underestimation of disease severity and inadequate treatment, potentially resulting in premature cardiovascular events. This approach fails to recognize the multifactorial nature of lipid metabolism and its disorders. Finally, an approach that relies solely on a single lipid panel result without considering trends, patient history, or other clinical data is also professionally flawed. Lipid levels can fluctuate due to various factors, including recent meals, illness, or medication changes. A comprehensive assessment requires serial measurements and integration with other clinical information to establish a reliable diagnosis and monitor treatment efficacy. This approach lacks the necessary depth for accurate clinical decision-making. Professional reasoning. Professionals should employ a structured diagnostic process that begins with a detailed patient history, including family history of cardiovascular disease and lipid disorders. This is followed by a thorough physical examination and a comprehensive lipid panel. Based on these initial findings, further investigations may be warranted, including genetic testing if a primary genetic disorder is suspected, or tests to rule out secondary causes of dyslipidemia. Treatment decisions should be guided by evidence-based guidelines, considering the patient's individual risk factors and the specific type and severity of dyslipidemia. Regular follow-up and monitoring are essential to assess treatment effectiveness and adjust the management plan as needed. Question 7. The efficiency study reveals that a novel multiplex PCR assay can detect a panel of common respiratory pathogens with significantly higher sensitivity and specificity compared to existing methods. However, the study was conducted by the research team that developed the assay, using samples from a single clinical site. Which of the following represents the most appropriate next step to ensure the reliable and ethical implementation of this assay in a broader clinical research setting? Option A. Discontinue further development of the assay, considering the potential for bias in the initial study. Option B. Immediately implement the assay in routine clinical diagnostics at the originating institution, given its promising results. Option C. Conduct independent validation of the assay in a separate laboratory using a diverse set of samples from multiple clinical sites. Option D. Publish the findings in a high-impact journal without further validation, highlighting its superior performance. The correct answer is C. Conduct independent validation of the assay in a separate laboratory using a diverse set of samples from multiple clinical sites. Explanation. Scenario analysis. This scenario presents a professional challenge related to the responsible use and interpretation of molecular biology techniques in a clinical research setting. The challenge lies in ensuring that the findings from a novel technique are validated and interpreted within established scientific and regulatory frameworks before being applied to patient care or further research. Misinterpreting or overstating the significance of preliminary findings can lead to flawed conclusions, wasted resources, and potentially compromised patient safety if clinical decisions are based on unverified data. The need for rigorous validation is paramount in medical research, especially when dealing with new methodologies. Correct approach analysis. The correct approach emphasizes the critical need for independent validation of a novel molecular biology technique. In the context of U.S. medical research and clinical application, this aligns with the principles of good clinical practice, GCP, and the regulatory oversight by the Food and Drug Administration, FDA. Independent validation by a separate laboratory using a different cohort of samples is a cornerstone of scientific rigor. This process ensures reproducibility, identifies potential biases in the original study, and confirms the technique's reliability and generalizability. Adhering to these validation steps is essential for building confidence in the technique's utility and for meeting the standards required for potential future regulatory approval or widespread adoption in clinical practice. Incorrect approaches analysis. One incorrect approach involves immediately adopting the technique for widespread clinical use based solely on the initial efficiency study. This fails to acknowledge the inherent limitations of a single study and bypasses crucial validation steps. Ethically, this is problematic as it risks exposing patients to diagnostic or therapeutic strategies based on unproven methods, violating the principle of do no harm. From a regulatory standpoint, it disregards the established pathways for evaluating and approving new medical technologies, potentially leading to non-compliance with FDA guidelines. Another incorrect approach is to publish the findings without any further validation, claiming definitive results. This constitutes scientific misconduct by presenting preliminary or unconfirmed data as conclusive. It undermines the integrity of the scientific literature and can mislead other researchers and clinicians. Regulatory bodies like the FDA expect robust evidence, and premature publication of unsubstantiated claims can jeopardize future research endeavors and funding. Third incorrect approach is to dismiss the technique entirely without attempting any form of validation, even if the initial efficiency study shows promise. While caution is warranted, outright dismissal without further investigation can lead to the loss of potentially valuable advancements. This approach lacks scientific curiosity and the systematic evaluation required to advance medical knowledge. It fails to engage with the scientific process of verification and refinement. Professional reasoning. Professionals faced with novel molecular biology techniques should adopt a systematic and evidence-based decision-making process. This involves 1. Critically evaluating the initial study's methodology and results. 2. Recognizing the need for independent replication and validation. 3. Planning and executing rigorous validation studies, ideally in different settings or with different sample populations. 4. Collaborating with other researchers and institutions to confirm findings. 5. Presenting results transparently, acknowledging limitations, and adhering to publication standards. 6. Engaging with regulatory bodies when the technique shows potential for clinical application. This structured approach ensures scientific integrity, ethical responsibility, and compliance with regulatory requirements. Question 8. The performance metrics show a slight increase in the rate of incidental findings on imaging studies that do not immediately correlate with the patient's presenting symptoms. A radiologist reviews a chest X-ray of a patient complaining of cough and fever, noting a subtle, unusual branching pattern of a pulmonary artery in the right upper lobe, which is not causing any apparent pathology. The radiologist is confident the finding is anatomical and not indicative of disease. What is the most appropriate next step for the radiologist? Option A. Consult with a thoracic surgeon to discuss the potential implications of this anatomical variation for future surgical interventions. Option B. Ignore the finding in the report, as it is not related to the patient's acute illness and could cause unnecessary patient anxiety. Option C. Document the anatomical variation in the report, noting its benign nature and lack of clinical correlation with the patient's current symptoms. Option D. Recommend immediate further imaging, such as a CT scan, to definitively rule out any underlying pathology associated with the unusual branching pattern. The correct answer is C. Document the anatomical variation in the report, noting its benign nature and lack of clinical correlation with the patient's current symptoms. Explanation. This scenario presents a professional challenge due to the inherent variability in human anatomy and the potential for misinterpretation or delayed diagnosis when such variations are encountered. The physician's responsibility is to maintain a high standard of care, which includes recognizing and appropriately managing anatomical anomalies. The performance metrics in this context likely reflect diagnostic accuracy and patient outcomes, highlighting the critical need for precise anatomical knowledge. The correct approach represents best professional practice because it prioritizes patient safety and diagnostic accuracy. By immediately consulting anatomical resources and considering potential variations, the physician demonstrates a commitment to thoroughness and avoids premature conclusions. This aligns with the ethical principle of beneficence, ensuring the patient receives the most accurate diagnosis and appropriate treatment. Furthermore, it upholds the professional standard of care, which mandates that physicians possess and apply current knowledge, including an understanding of anatomical variations, to their practice. Regulatory frameworks for medical practice in the U.S. emphasize continuous learning and the application of evidence-based medicine, which implicitly includes recognizing and managing anatomical diversity. An incorrect approach of dismissing the finding as insignificant would be a regulatory and ethical failure. It demonstrates a lack of diligence and could lead to a misdiagnosis, potentially harming the patient. This violates the duty of care and the principle of non-maleficence. Another incorrect approach, such as proceeding with treatment based on a presumed standard anatomy without further investigation, also constitutes a failure. This could result in ineffective or even harmful treatment if the anatomical variation significantly alters the expected response. Such actions could be viewed as practicing below the accepted standard of care, which is subject to regulatory oversight and professional disciplinary action. Failing to consult relevant literature or colleagues when faced with an unusual finding represents a lapse in professional judgment and a departure from best practices, potentially leading to adverse patient outcomes and regulatory scrutiny. The professional reasoning process in such a situation should involve a systematic approach. First, acknowledging the observed finding. Second, considering its potential significance in light of the patient's presentation. Third, actively seeking information to clarify the finding, which may involve consulting anatomical atlases, imaging databases, or relevant literature. Fourth, if necessary, seeking consultation with colleagues or specialists. And finally, integrating all gathered information to formulate an accurate diagnosis and treatment plan. This iterative process ensures that anatomical variations are not overlooked and that patient care is guided by comprehensive understanding. Question 9. The control framework reveals a biopsy specimen exhibiting cells with enlarged, irregularly shaped nuclei, prominent nucleoli, and a significant increase in the nuclear cytoplasmic ratio. The cytoplasm appears basophilic and contains sparse, irregularly distributed organelles. These cellular abnormalities are most consistent with which of the following cellular dysfunctions? Option A. Impaired mitochondrial respiration leading to ATP depletion and cellular swelling. Option B. Defective lysosomal enzyme activity resulting in the accumulation of undigested material. Option C. Uncontrolled cell proliferation and genetic instability driven by mutations in cell cycle regulatory genes. Option D. Aberrant protein synthesis and folding due to endoplasmic reticulum dysfunction. The correct answer is A. Impaired mitochondrial respiration leading to ATP depletion and cellular swelling. Explanation. The control framework reveals a scenario where a physician must interpret cellular pathology to guide patient management, a core competency tested in USML Step 1. The challenge lies in accurately diagnosing a disease process based on microscopic findings, which directly impacts treatment decisions and patient prognosis. This requires a deep understanding of normal cell structure and function, as well as the pathological alterations that occur in disease. The correct approach involves a systematic evaluation of the provided cellular morphology, correlating it with known disease entities and their underlying pathogenetic mechanisms. This aligns with best professional practice as it ensures evidence-based medical decision-making, prioritizing patient safety and effective treatment. The USML Step 1 emphasizes this integration of basic science knowledge with clinical application, requiring physicians to demonstrate proficiency in diagnosing and managing diseases based on fundamental biological principles. An incorrect approach would be to make a diagnosis based on incomplete or superficial observation, or to rely on anecdotal evidence rather than established scientific principles. Such actions represent a failure to adhere to the rigorous standards of medical practice expected of physicians. Specifically, misinterpreting cellular structures or functions can lead to misdiagnosis, inappropriate treatment, and potentially harmful outcomes for the patient. This violates the ethical obligation to provide competent care and the regulatory expectation that physicians possess a thorough understanding of disease processes at the cellular level. Furthermore, failing to consult relevant literature or seek expert opinion when uncertain demonstrates a lack of professional diligence and a disregard for patient well-being. The decision-making process should involve a structured approach. First, carefully observe and document all relevant cellular features. Second, consider differential diagnoses based on these features. Third, consult reliable resources to confirm or refine the diagnosis. And finally, formulate a treatment plan based on the confirmed diagnosis and established guidelines. Question 10. The control framework reveals a physician is evaluating a patient for potential appendicitis and needs to palpate for tenderness in the right lower quadrant. To accurately assess this region, the physician must identify specific bony landmarks. Which of the following bony landmarks is most critical for orienting the physician to the general area of the appendix's typical location? Option A, the olecranon. Option B, the pubic symphysis. Option C, the anterior superior iliac spine. Option D, the xiphoid process. The correct answer is C, the anterior superior iliac spine. Explanation: this scenario is professionally challenging because it requires the physician to integrate knowledge of surface anatomy with the immediate needs of a patient presenting with a potentially critical condition. The physician must accurately identify anatomical landmarks to guide a diagnostic or therapeutic intervention, and any misidentification could lead to delayed diagnosis, ineffective treatment, or iatrogenic injury. Careful judgment is required to ensure the safety and well-being of the patient. The correct approach represents best professional practice because it prioritizes patient safety and effective care through accurate anatomical knowledge. Identifying the precise location of the anterior superior iliac spine is crucial for procedures such as palpating the inguinal ligament, assessing for hernias, or guiding the insertion of needles for regional anesthesia or diagnostic aspiration in the pelvic region. Adherence to established anatomical landmarks ensures that interventions are performed in the correct anatomical plane, minimizing the risk of damage to underlying structures like nerves, blood vessels, or organs. This aligns with the fundamental ethical and professional obligation to provide competent and safe medical care, as expected within the U.S. medical regulatory framework. An incorrect approach of relying on a general estimation of the hip bone's prominence without precise landmark identification is professionally unacceptable. This failure constitutes a breach of the standard of care, as it demonstrates a lack of diligence in applying essential anatomical knowledge. Ethically, it risks patient harm due to potential misplacement of interventions, which violates the principle of non-maleficence. From a regulatory perspective, such an approach could be considered negligence, falling short of the expected competency for a practicing physician in the United States. Another incorrect approach of proceeding with the procedure without confirming the anatomical landmark, perhaps due to time pressure or overconfidence, is also professionally unacceptable. This bypasses a critical step in ensuring procedural accuracy and patient safety. It demonstrates a disregard for the systematic approach to clinical examination and intervention, potentially leading to significant complications. This failure to adhere to established medical protocols and the principle of due diligence is a regulatory and ethical concern. A further incorrect approach of delegating the identification of the landmark to an untrained individual without direct supervision would be a severe ethical and regulatory failure. This not only demonstrates a lack of personal accountability, but also exposes the patient to undue risk from an unqualified practitioner. It violates the physician's responsibility to ensure that all medical care provided under their purview meets the highest standards of safety and competence. The professional decision-making process for similar situations should involve a systematic approach. First, clearly define the clinical question or procedural goal. Second, recall and visualize the relevant surface anatomy and its relationship to underlying structures. Third, meticulously palpate and identify the specific anatomical landmarks required for the task. Fourth, confirm the accuracy of the identified landmarks before proceeding with any intervention. Finally, continuously reassess the situation and the patient's response throughout the procedure. This methodical approach, grounded in robust anatomical knowledge and a commitment to patient safety, is the cornerstone of effective and ethical medical practice in the United States. Question 11. The performance metrics show a patient admitted with shortness of breath who has a declining SpO2 despite supplemental oxygen. Arterial blood gas analysis reveals a significant widening of the alveolar arterial oxygen gradient. The patient is tachypneic with shallow breaths and has a normal end-tidal CO2. Which of the following physiological assessments is most crucial for guiding further management? Option A, determining the cardiac output and pulmonary artery pressures. Option B, assessing the distribution of ventilation and perfusion within the lungs. Option C, evaluating the patient's response to bronchodilator therapy. Option D, measuring the patient's minute ventilation and respiratory rate. Correct answer is C, Evaluating the patient's response to bronchodilator therapy. Explanation. Scenario analysis. This scenario presents a clinically challenging situation where a patient's respiratory status is deteriorating despite initial interventions. The challenge lies in accurately interpreting the physiological data to identify the underlying cause of hypoxemia and guide appropriate management, balancing the urgency of the situation with the need for precise diagnostic reasoning. The physician must consider multiple potential etiologies for the observed changes in oxygenation and ventilation. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's respiratory physiology, focusing on the fundamental determinants of gas exchange. This includes assessing the alveolar arterial oxygen gradient, AIA gradient, which helps differentiate between intrapulmonary and extrapulmonary causes of hypoxemia. An elevated AIA gradient suggests an intrapulmonary problem such as V/Q mismatch, shunt, or diffusion limitation, while a normal AIA gradient points towards hypoventilation or a low inspired oxygen fraction. Understanding the relationship between ventilation and perfusion, V/Q, is crucial for diagnosing conditions like pulmonary embolism or pneumonia. Furthermore, assessing the patient's work of breathing and end-tidal CO2 levels provides insights into ventilatory adequacy and the potential for respiratory muscle fatigue. This comprehensive physiological assessment, guided by established principles of respiratory medicine, aligns with the USML Step 1 emphasis on applying foundational science knowledge to clinical problem solving, and represents best professional practice by ensuring a targeted and effective diagnostic and therapeutic strategy. Incorrect approaches analysis. One incorrect approach would be to solely focus on increasing the fraction of inspired oxygen, FiO2, without a thorough physiological assessment. This fails to address the root cause of the hypoxemia and could mask underlying pathology, potentially leading to delayed or inappropriate treatment. Ethically, this approach could be considered negligent, as it does not involve diligent investigation of the patient's condition. Another incorrect approach would be to immediately initiate mechanical ventilation without a clear indication or understanding of the specific ventilatory defect. While mechanical ventilation can support breathing, its initiation without proper physiological assessment can lead to complications such as ventilator-induced lung injury or barotrauma, and it does not address the underlying cause of the hypoxemia. This represents a failure in professional judgment and adherence to evidence-based practice. A third incorrect approach would be to attribute the hypoxemia solely to a cardiac etiology without considering pulmonary causes. While cardiac conditions can impact oxygenation, a comprehensive respiratory assessment is paramount in a patient presenting with respiratory distress and hypoxemia. This narrow focus could lead to misdiagnoses and suboptimal patient care, violating the professional duty to provide thorough and accurate medical evaluation. Professional reasoning. Professionals facing such a scenario should employ a structured diagnostic process. This involves 1. Gathering a detailed history and performing a thorough physical examination. 2. Reviewing available diagnostic data, including vital signs, laboratory results, and imaging. 3. Applying foundational physiological principles to interpret the findings and generate a differential diagnosis. 4. Prioritizing investigations to confirm or refute the most likely diagnoses. 5. Developing a management plan based on the confirmed diagnosis and the patient's overall clinical status, continuously reassessing and adjusting as needed. This systematic approach ensures patient safety and optimizes outcomes, reflecting the ethical and professional standards expected in medical practice. Question 12. The audit findings indicate that a patient's laboratory results show a significant decrease in the maximal velocity Vmax of a key metabolic enzyme, but the Michaelis-Menten constant, Km, remains unchanged. This observation is being reviewed in the context of the patient's recent initiation of a new medication. Which of the following is the most likely explanation for these kinetic changes and the appropriate next step in patient management? Option A. The medication is acting as an uncompetitive inhibitor, decreasing both the enzyme's maximal velocity and its affinity for the substrate. The physician should consider discontinuing the medication immediately. Option B. The medication is acting as a competitive inhibitor, increasing the substrate concentration required to reach half of the maximal velocity. The physician should increase the dosage of the substrate to overcome the inhibition. Option C. The medication is acting as a non-competitive inhibitor, reducing the enzyme's catalytic efficiency without affecting substrate binding. Further investigation into the medication's specific mechanism of action and potential for drug-drug interactions is warranted. Option D. The observed changes in Vmax and Km are not clinically significant and do not require further investigation or management adjustments. The correct answer is C. The medication is acting as a non-competitive inhibitor, reducing the enzyme's catalytic efficiency without affecting substrate binding. Further investigation into the medication's specific mechanism of action and potential for drug-drug interactions is warranted. Explanation. Scenario analysis. This scenario presents a challenge in a clinical setting where a physician must interpret laboratory data related to enzyme activity in the context of a patient's condition. The audit findings highlight a potential discrepancy between expected enzyme behavior and observed results, requiring the physician to apply their understanding of enzyme kinetics to ensure appropriate patient management and avoid misdiagnosis or ineffective treatment. The professional challenge lies in accurately diagnosing the underlying cause of the altered enzyme kinetics and selecting the most effective therapeutic strategy based on this understanding, all while adhering to established medical practice guidelines. Correct approach analysis. The correct approach involves recognizing that a decrease in Vmax, while Km remains unchanged, is characteristic of non-competitive inhibition. In a clinical context, this suggests that the patient's condition or a co-administered medication is interfering with the enzyme's catalytic efficiency without affecting its substrate binding affinity. This understanding guides further investigation into potential inhibitors or disease processes that manifest with this specific kinetic profile. Best professional practice dictates that a physician should interpret enzyme kinetics data in light of the patient's clinical presentation and known disease mechanisms, leading to a targeted diagnostic workup and appropriate treatment. This aligns with the USML Step 1 emphasis on integrating basic science knowledge with clinical application, ensuring physicians can make informed decisions based on physiological and biochemical principles. Incorrect approach is analysis. An approach that attributes a decrease in Vmax and an increase in Km to competitive inhibition is incorrect. Competitive inhibition involves a substance that competes with the substrate for the enzyme's active site, leading to an increase in Km, higher substrate concentration needed to reach half Vmax, but no change in Vmax. The maximum rate can still be achieved with sufficient substrate. This misinterpretation would lead to an incorrect diagnosis and potentially inappropriate treatment. Ethically, this represents a failure to apply fundamental biochemical principles accurately, potentially harming the patient. An approach that suggests an increase in both Vmax and Km is characteristic of uncompetitive inhibition. Uncompetitive inhibition occurs when the inhibitor binds only to the enzyme substrate complex, leading to a decrease in both Vmax and Km. This misinterpretation would also lead to an incorrect understanding of the underlying mechanism. Regulatory failure here lies in not adhering to the established kinetic models of enzyme inhibition, which are foundational to understanding drug-enzyme interactions and disease pathophysiology. An approach that concludes that changes in Vmax and Km are irrelevant to patient management is fundamentally flawed. Enzyme kinetics are critical for understanding disease processes and drug mechanisms of action. Ignoring such data would be a dereliction of professional duty, potentially leading to suboptimal patient care and misdiagnosis. This constitutes a significant ethical failure and a violation of the standard of care expected of a physician. Professional reasoning. When faced with laboratory findings that deviate from expected patterns, a physician must engage in a systematic problem-solving process. This involves 1. Recalling fundamental principles of enzyme kinetics and the different types of inhibition. 2. Correlating the observed kinetic changes, Vmax, Km, with specific types of inhibition. 3. Considering the patient's clinical history, symptoms, and current medications as potential explanations for the observed enzyme behavior. 4. Formulating a differential diagnosis based on the most likely kinetic mechanism. 5. Ordering further investigations, or initiating targeted treatment based on the most probable diagnosis. This structured approach ensures that clinical decisions are evidence-based and grounded in scientific understanding, aligning with the ethical and professional responsibilities of a physician. Question 13. Operational review demonstrates a 45-year-old male presenting with persistent unilateral facial weakness and numbness that began approximately 72 hours after a minor head contusion sustained during a fall. Initial neurological examination reveals a mild ipsilateral facial droop and diminished sensation to light touch in the V2 dermatome. A CT scan of the head shows no evidence of intracranial hemorrhage or mass effect. However, the patient reports a new onset of intermittent, sharp, electric shock-like pain radiating from the jaw to the ear on the affected side, particularly when he chews or speaks. Which of the following is the most appropriate next step in the management of this patient? Option A. Reassure the patient that symptoms will resolve spontaneously and schedule a follow-up in 2 weeks. Option B. Order an MRI of the brain and internal auditory canals with contrast. Option C. Prescribe a course of antiviral medication and advise symptomatic pain management. Option D. Initiate a trial of high-dose corticosteroids and refer for a neurology consultation. Correct answer is D. Initiate a trial of high-dose corticosteroids and refer for a neurology consultation. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the physician to interpret complex neurological findings in the context of a patient's subjective symptoms and potential underlying pathology. The challenge lies in distinguishing between normal physiological processes, expected post-injury changes, signs of a more serious or progressive neurological condition that necessitates immediate intervention. Accurate diagnosis and appropriate management are critical for patient outcomes and preventing further harm. Correct approach analysis. The correct approach involves a systematic and comprehensive evaluation of the patient's neurological status, integrating both objective findings from the examination and diagnostic tests with the patient's reported symptoms. This approach aligns with best professional practice by prioritizing patient safety and well-being through thorough assessment and evidence-based decision-making. Specifically, it adheres to the principles of diagnostic reasoning, which emphasize the iterative process of hypothesis generation, testing, and refinement based on all available data. This methodical approach ensures that all potential diagnoses are considered and that the most likely cause of the patient's symptoms is identified, leading to the most effective treatment plan. Incorrect approaches analysis. One incorrect approach would be to dismiss the patient's symptoms as solely due to the known trauma without further investigation. This fails to acknowledge the possibility of secondary complications or unrelated neurological issues, potentially delaying diagnosis and treatment of a more serious condition. Ethically, this represents a failure to provide adequate care and a breach of the physician's duty to investigate all plausible causes of a patient's distress. Another incorrect approach would be to solely rely on the imaging findings without correlating them with the patient's clinical presentation. While imaging is a crucial diagnostic tool, it must be interpreted in the context of the patient's symptoms and neurological examination. Over-reliance on imaging alone can lead to misinterpretation or overlooking subtle but clinically significant findings. This approach risks misdiagnosis and inappropriate treatment, violating the principle of beneficence. A third incorrect approach would be to initiate aggressive treatment based on preliminary or incomplete information without a clear diagnostic rationale. This could lead to unnecessary interventions, potential side effects, and a failure to address the root cause of the patient's symptoms. This approach is contrary to the principle of non-maleficence, as it risks causing harm without a clear benefit. Professional reasoning. Professionals should employ a structured decision-making framework that begins with a thorough history and physical examination, followed by the generation of differential diagnoses. Diagnostic tests should be ordered strategically to confirm or refute these hypotheses. Findings from all sources, including patient reports, physical exam, and diagnostic tests, must be synthesized to arrive at the most accurate diagnosis. Treatment decisions should be based on this diagnosis and guided by evidence-based guidelines and patient-specific factors. Regular reassessment is crucial to monitor treatment effectiveness and adjust the plan as needed. Question 14. The control framework reveals a patient presenting with insidious onset of pain in the anterolateral aspect of the shoulder, exacerbated by overhead activities and weakness when attempting to abduct the arm against resistance. The patient also reports difficulty sleeping on the affected side. Based on these clinical findings and a thorough understanding of musculoskeletal anatomy, which of the following anatomical structures is most likely implicated? Option A, supraspinatus tendon. Option B, biceps brachii long head tendon. Option C, trapezius muscle. Option D, deltoid muscle. The correct answer is A. Supraspinatus tendon. Explanation. Scenario analysis. This scenario presents a challenge in accurately identifying anatomical structures based on their functional relationships and common clinical presentations, requiring a strong foundation in musculoskeletal anatomy. Misidentification can lead to incorrect diagnoses and inappropriate treatment plans, impacting patient care and potentially violating standards of practice. Correct approach analysis. The correct approach involves systematically evaluating the described symptoms and their anatomical origins. Understanding the biomechanics of the shoulder joint, including the rotator cuff muscles and their insertions, is crucial for pinpointing the source of pain and weakness. This aligns with the USML Step 1 emphasis on integrating basic science knowledge with clinical application, ensuring a physician can accurately diagnose and manage patient conditions. Correct approaches analysis. An approach that focuses solely on superficial palpation without considering the underlying musculature and joint mechanics would be insufficient. This fails to meet the diagnostic rigor expected in medical practice, potentially leading to misdiagnosis. An approach that prioritizes imaging studies without a thorough clinical examination and anatomical understanding is inefficient and can lead to unnecessary costs and patient anxiety. While imaging is important, it complements, rather than replaces, clinical assessment. An approach that relies on anecdotal evidence or patient self-diagnosis, rather than established anatomical and physiological principles, is professionally unacceptable and directly contradicts the evidence-based practice expected of physicians. Professional reasoning. Professionals should approach diagnostic challenges by first recalling and applying foundational anatomical knowledge. This is followed by a systematic clinical examination, correlating findings with anatomical structures and their functions. When necessary, diagnostic tools are employed to confirm or refine the diagnosis. This structured approach ensures patient safety, diagnostic accuracy, and adherence to professional standards of care. Question 15. The monitoring system demonstrates a patient presenting with recurrent episodes of muscle weakness, fatigue, and exercise intolerance. Laboratory investigations reveal elevated levels of glucose 6-phosphate and lactate in muscle tissue following strenuous activity. Further analysis indicates a deficiency in a key glycolytic enzyme responsible for the conversion of fructose 6-phosphate to fructose 1,6-bisphosphate. Which of the following is the most likely diagnosis based on these findings? Option A, hereditary phosphofructokinase deficiency. Option B, glycogen storage disease type I von Gierke disease. Option C, hereditary fructose 1,6-bisphosphatase deficiency. Option D, glycogen storage disease type V McArdle disease. The correct answer is D, glycogen storage disease type V McArdle disease. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the clinician to interpret complex biochemical data in the context of a patient's clinical presentation and to make a critical therapeutic decision. The challenge lies in distinguishing between a primary metabolic disorder and a secondary consequence of another underlying condition, which necessitates a thorough understanding of carbohydrate metabolism pathways and their regulatory mechanisms. Accurate diagnosis and management are paramount to prevent serious morbidity and mortality. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's symptoms, physical examination findings, and laboratory results, specifically focusing on the pattern of enzyme deficiencies and their impact on glucose homeostasis. This aligns with best professional practice as dictated by the principles of evidence-based medicine and the ethical obligation to provide competent patient care. The U.S. medical regulatory framework emphasizes diagnostic accuracy and appropriate treatment based on established scientific understanding. Identifying the specific enzyme defect in glycolysis, such as phosphofructokinase deficiency, and understanding its downstream effects on ATP production and lactate accumulation is crucial for guiding management. Incorrect approaches analysis. An incorrect approach would be to solely focus on the elevated lactate levels without considering the broader metabolic context. This would be a regulatory and ethical failure because it represents a superficial diagnosis and could lead to inappropriate treatment, potentially masking the true underlying cause and delaying definitive care. For instance, treating only the symptom of lactic acidosis without addressing the root cause of impaired glycolysis would violate the principle of providing effective and comprehensive medical care. Another incorrect approach would be to attribute the symptoms to a common, less severe condition without sufficient investigation. This demonstrates a failure in due diligence and diagnostic rigor, potentially leading to misdiagnoses of serious metabolic disorders. The regulatory expectation is for physicians to exhaust appropriate diagnostic avenues before settling on a diagnosis, especially when presented with atypical or concerning findings. A third incorrect approach would be to initiate treatment based on a presumptive diagnosis without confirming the specific enzyme deficiency. This is a significant ethical and regulatory lapse, as it exposes the patient to unnecessary risks associated with unindicated therapies and deviates from the standard of care, which mandates diagnostic confirmation for rare genetic disorders. Professional reasoning. Professionals should approach such a scenario by first gathering all available clinical and laboratory data. They should then formulate a differential diagnosis, considering various metabolic pathways and potential disruptions. A systematic approach to interpreting biochemical markers, understanding the physiological consequences of enzyme deficiencies, and correlating these findings with the patient's clinical picture is essential. This involves consulting relevant medical literature and potentially seeking expert consultation to ensure the most accurate diagnosis and effective management plan, thereby upholding professional standards and patient safety. Question 16. Assessment of the optimal microscopy technique for evaluating cellular morphology on a routine peripheral blood smear for a patient presenting with suspected anemia. Option A, bright field microscopy with right gene sustaining. Option B, fluorescence microscopy without specific probes. Option C, phase contrast microscopy without staining. Option D, electron microscopy with standard fixation. The correct answer is A, bright field microscopy with right gene sustaining. Explanation. Scenario analysis. This scenario presents a challenge in selecting the most appropriate microscopy technique for a specific diagnostic task. The physician must balance the need for detailed cellular visualization with the practical constraints of sample preparation, time, and available resources, all while ensuring the accuracy and reliability of the diagnostic findings, which directly impacts patient care. Correct approach analysis. The correct approach involves selecting a microscopy method that provides the necessary resolution and contrast for identifying the specific cellular features relevant to the suspected diagnosis. For routine hematology and cytology, right gene sustaining with bright field microscopy is the gold standard. This technique allows for clear visualization of cell morphology, nuclear and cytoplasmic details, and the presence of inclusions or abnormal structures, which are critical for diagnosing conditions like anemia, leukemia, or infections. This aligns with established clinical laboratory standards and best practices for diagnostic microscopy in the United States, ensuring accurate and reproducible results. Incorrect approach is analysis. Using phase contrast microscopy without appropriate staining would fail to provide the necessary contrast to differentiate cellular components effectively, leading to potential misinterpretation or misdiagnoses. This approach lacks the established validation and standardization required for reliable diagnostic microscopy in a clinical setting. Employing electron microscopy for routine peripheral blood smear examination is an unnecessary and impractical approach. Electron microscopy offers superior resolution. Its complex sample preparation, high cost, and specialized equipment make it unsuitable for rapid, routine diagnostic purposes. Its use would violate principles of efficient resource allocation and timely patient care. Utilizing fluorescence microscopy without a specific fluorescent probe or antibody would yield no diagnostic information. Fluorescence microscopy relies on the excitation of specific fluorophores to generate an image, and without this targeted approach, the technique is not applicable for general morphological assessment. This represents a fundamental misunderstanding of the technique's application. Professional reasoning. Professionals should approach diagnostic microscopy by first considering the clinical question and the specific cellular features that need to be evaluated. This guides the selection of the most appropriate staining technique and microscope type. They should then consider the availability of equipment and reagents, the time required for sample preparation and examination, and the established diagnostic criteria for the suspected condition. Adherence to CLIA, Clinical Laboratory Improvement Amendments, regulations and institutional protocols is paramount to ensure quality and accuracy in diagnostic testing. Question 17. Comparative studies suggest that the detection of intracellular inclusions in a patient's liver biopsy is crucial for diagnosing a specific metabolic disorder. The pathologist suspects these inclusions are rich in lipids, which histological technique would be most appropriate for definitively visualizing these lipid-rich inclusions in the biopsy specimen. Option A, periodic acid SCIF PAS staining. Option B, Masson's trichrome staining. Option C, oil red O staining. Option D, hematoxylin and eosin H&E staining. The correct answer is D, hematoxylin and eosin H&E staining. Explanation: scenario analysis. This scenario presents a challenge in selecting the most appropriate histological technique for visualizing a specific cellular component in a clinical context. The physician must balance the need for accurate diagnostic information with the practical considerations of tissue processing and the limitations of various staining methods. Misinterpretation due to an inappropriate technique can lead to diagnostic errors, impacting patient care and potentially leading to unnecessary or incorrect treatments. Correct approach analysis. The correct approach involves selecting a stain that specifically targets and highlights the suspected cellular abnormality, ensuring clear visualization for diagnosis. This aligns with the principles of evidence-based medicine and the ethical obligation to provide accurate and timely diagnostic services. The chosen technique should be validated and reliable for the intended purpose, contributing to the overall quality of patient care within the U.S. healthcare system. Incorrect approaches analysis. Using a general histological stain without specific targeting for the suspected abnormality may obscure crucial diagnostic features or lead to false positives/negatives. This represents a failure to apply best practices in diagnostic pathology and could be considered a deviation from the standard of care, potentially violating professional guidelines for diagnostic accuracy. Employing a technique that requires specialized equipment or reagents not readily available in a standard clinical laboratory without prior justification or planning can delay diagnosis and compromise patient management. This demonstrates a lack of consideration for practical resource allocation and efficient patient workflow, which are implicit expectations in professional practice. Selecting a stain known for poor fixation or artifact generation, especially when a more reliable alternative exists, introduces unnecessary uncertainty into the diagnostic process. This can lead to misdiagnosis and reflects a failure to adhere to quality control standards in laboratory procedures, potentially impacting the integrity of the diagnostic findings. Professional reasoning. Professionals should approach such decisions by first considering the clinical question and the suspected pathology. They should then review the available histological techniques, evaluating their specificity, sensitivity, reliability, and practicality within their specific clinical setting. Consulting relevant literature, established protocols, and experienced colleagues can further inform the decision-making process, ensuring the selection of the most appropriate and effective diagnostic method. Question 18. Benchmark analysis indicates that a patient with a history of poorly controlled type 2 diabetes and recent cardiac decompensation is presenting with symptoms suggestive of worsening glycemic dysregulation. The patient has a history of inconsistent medication adherence. Which of the following management strategies best upholds the principles of maintaining homeostasis and patient safety within the U.S. regulatory framework? Option A. Immediately initiate the highest recommended dose of a new antihyperglycemic agent to rapidly achieve glycemic control, given the patient's history of poor adherence. Option B. Rely exclusively on the patient's subjective reports of thirst and fatigue to guide adjustments in their antihyperglycemic therapy. Option C. Discontinue all antihyperglycemic medications due to the patient's history of non-adherence and focus solely on dietary recommendations. Option D. Gradually titrate the patient's antihyperglycemic medication upwards, closely monitoring blood glucose levels, renal function, and cardiac status for any signs of instability. Correct answer is D. Gradually titrate the patient's antihyperglycemic medication upwards, closely monitoring blood glucose levels, renal function, and cardiac status for any signs of instability. Explanation. Scenario analysis. This scenario presents a challenge in managing a patient with a chronic condition that significantly impacts their homeostatic mechanisms. The physician must balance aggressive treatment to address acute symptoms with the potential for iatrogenic disruption of already compromised physiological systems. The patient's history of non-adherence adds a layer of complexity, requiring a nuanced approach that considers patient autonomy, therapeutic efficacy, and the risk of adverse events. Correct approach analysis. The correct approach prioritizes a gradual, titrated increase in medication dosage, while closely monitoring the patient's physiological responses. This aligns with best practices in managing conditions affecting homeostasis, such as diabetes or heart failure, where rapid changes can destabilize the patient. The U.S. regulatory framework, as embodied by the principles of evidence-based medicine and patient safety emphasized by the Food and Drug Administration, FDA, and professional medical organizations, supports this cautious, iterative method. It minimizes the risk of precipitating a dangerous homeostatic imbalance, such as severe hypoglycemia or cardiac decompensation, by allowing the body to adapt to incremental therapeutic interventions. This approach respects the physician's duty of care and the ethical principle of non-maleficence. Incorrect approaches analysis. One incorrect approach involves immediately escalating the medication to the maximum recommended dose. This fails to account for the patient's compromised homeostatic capacity and the potential for rapid, severe adverse effects. Ethically, this violates the principle of non-maleficence by exposing the patient to an unacceptable level of risk without sufficient justification or gradual adaptation. From a regulatory perspective, it could be seen as a deviation from standard of care, potentially leading to malpractice claims if harm results. Another incorrect approach is to discontinue the medication due to past non-adherence, without exploring the underlying reasons or offering alternative strategies. This abandons the patient and their condition, failing to uphold the physician's responsibility to provide care. It disregards the ethical obligation to beneficence and could be construed as a breach of the patient-physician relationship, potentially violating professional conduct guidelines. A third incorrect approach is to solely rely on patient self-reporting of symptoms without objective physiological monitoring. While patient input is crucial, in conditions affecting homeostasis, subjective reports can be unreliable or lag behind significant physiological changes. This approach risks missing critical, objective signs of decompensation, leading to delayed or inadequate intervention, which is contrary to the principles of diligent medical practice and patient safety. Professional reasoning. Professionals should approach such cases by first conducting a thorough assessment of the patient's current homeostatic status and identifying the specific physiological systems affected. They should then develop a treatment plan that is individualized, considering the patient's history, comorbidities, and potential for adherence. This plan should incorporate regular, objective monitoring of key physiological parameters, communication with the patient about the rationale for the treatment plan, potential risks and benefits, and the importance of adherence is paramount. If adherence is a concern, exploring the barriers and offering support or alternative strategies is essential before considering discontinuation of care. The decision-making process should be guided by evidence-based medicine, ethical principles, and regulatory requirements for patient safety and quality of care. Question 19. To address the challenge of accurately communicating a newly discovered lesion's position to a consulting surgeon, a medical student is reviewing their notes. The lesion is located on the posterior aspect of the right upper limb, distal to the elbow joint and medial to the humerus. Which of the following descriptions best utilizes standardized anatomical terminology for precise localization? Option A. The lesion is located on the posterior aspect of the right arm, inferior to the elbow and medial to the humerus. Option B. The lesion is felt on the posterior side of the right arm, just past the elbow on the inner part. Option C. The lesion is situated on the dorsal surface of the right antebrachium, medial to the distal humerus. Option D. The lesion is on the back of the right arm, below the elbow and closer to the inside than the outside. The correct answer is D. The lesion is on the back of the right arm, below the elbow and closer to the inside than the outside. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical need for precise anatomical communication in a high-stakes medical environment. Misinterpreting or miscommunicating anatomical locations can lead to diagnostic errors, inappropriate treatment, and patient harm. Pressure of a time-sensitive situation, coupled with the potential for ambiguity in descriptive language, necessitates a robust understanding and application of standardized anatomical terminology. Correct approach analysis. The correct approach involves utilizing universally accepted anatomical terminology to describe the location of the lesion. This adheres to the fundamental principles of clear and unambiguous medical communication, which is paramount for patient safety and effective collaboration among healthcare professionals. The USML Step 1 exam emphasizes this foundational knowledge as it underpins all subsequent clinical practice. Standardized terminology, derived from anatomical atlases and textbooks, ensures that all members of the healthcare team share a common understanding, minimizing the risk of misinterpretation. This aligns with the implicit regulatory expectation of competent medical practice, where accurate communication is a cornerstone of patient care. Incorrect approaches analysis, describing the lesion solely by its proximity to a palpable landmark without precise anatomical reference is professionally unacceptable. This approach introduces ambiguity and relies on subjective interpretation, which can vary significantly between individuals. It fails to meet the standard of objective and precise communication expected in medicine, potentially leading to confusion and errors in diagnosis or treatment planning. This represents a failure in professional diligence and adherence to best practices in medical communication. Using colloquial or informal terms to describe the lesion's location is also professionally unacceptable. While these terms might be understood in casual conversation, they lack the specificity and universality required in a medical context. Such language can be misinterpreted, especially by individuals from different backgrounds or with varying levels of medical knowledge, thereby compromising patient safety and the integrity of the medical record. This constitutes a lapse in professional communication standards. Referring to the lesion's location based on the patient's subjective feeling of pain, without objective anatomical correlation, is professionally inadequate. While patient-reported symptoms are vital, anatomical descriptions must be grounded in objective findings. Relying solely on subjective sensation can lead to inaccurate localization and misdiagnosis, as pain perception is not always directly proportional to the anatomical site of a lesion. This approach fails to employ objective diagnostic principles. Professional reasoning. Professionals should employ a systematic approach to anatomical description. This involves first identifying the relevant anatomical plane, e.g., sagittal, coronal, transverse, then referencing specific anatomical structures, bones, organs, muscles, using standardized terminology, and finally indicating the precise location relative to these structures, e.g., superior, inferior, anterior, posterior, medial, lateral, proximal, distal. When communicating with colleagues, especially in written records or during consultations, the use of precise, unambiguous anatomical terms is non-negotiable. This decision-making framework prioritizes clarity, accuracy, and patient safety above all else. Question 20. Strategic planning requires a physician to consider the most efficient biochemical diagnostic pathway when a patient presents with a constellation of symptoms suggestive of an inborn error of metabolism affecting amino acid processing. Given the patient's neurological deficits and elevated ammonia levels, which of the following initial diagnostic strategies best aligns with established U.S. medical practice and ethical considerations for patient care? Option A. Perform a liver biopsy to assess for enzyme deficiencies. Option B. Begin empirical treatment with a low-protein diet and monitor for symptom improvement. Option C. Initiate a broad panel of genetic tests for all known inborn errors of metabolism. Option D. Order a quantitative amino acid analysis and a blood gas analysis. Correct answer is C. Initiate a broad panel of genetic tests for all known inborn errors of metabolism. Explanation. Scenario analysis. This scenario presents a common challenge in clinical practice where a patient's symptoms suggest a metabolic disorder, but the initial diagnostic steps are inconclusive. The physician must navigate the complexities of biochemical pathways and their clinical manifestations, balancing the need for timely diagnosis and treatment with the potential for iatrogenic harm from unnecessary or inappropriate investigations. The challenge lies in applying foundational biochemical knowledge to a real-world clinical problem, considering differential diagnoses, and selecting the most efficient and effective diagnostic strategy within the established U.S. regulatory and ethical framework for patient care. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's presentation, considering the most likely biochemical derangements based on the symptoms. This includes a targeted assessment of key metabolic pathways known to be implicated in the patient's signs and symptoms. For instance, If the patient presents with neurological symptoms and a history suggestive of impaired energy metabolism, focusing on pathways like the urea cycle or mitochondrial function would be appropriate. This aligns with the U.S. medical regulatory framework's emphasis on evidence-based medicine, patient safety, and the physician's responsibility to order appropriate diagnostic tests that are medically indicated and cost-effective, avoiding unnecessary procedures that could lead to patient harm or increased healthcare costs. Ethical considerations, such as beneficence and non-maleficence, guide the physician to pursue the most direct and least invasive diagnostic route. Incorrect approach is analysis. Pursuing a broad, unfocused panel of biochemical tests without a clear hypothesis is an inefficient and potentially harmful approach. This violates the principle of ordering medically indicated tests and can lead to unnecessary patient anxiety, increased healthcare costs, and the possibility of incidental findings that may not be clinically relevant. From a regulatory standpoint, this could be seen as a failure to adhere to standards of care and prudent medical practice. Ordering highly specialized or experimental tests without sufficient preliminary evidence or a strong clinical rationale is also inappropriate. This could expose the patient to risks associated with these tests without a clear benefit and may not be covered by insurance, creating financial burdens. This approach disregards the established diagnostic algorithms and the principle of escalating diagnostic intensity based on clinical suspicion and initial findings, which is implicitly supported by U.S. healthcare regulations promoting efficient resource utilization. Focusing solely on symptomatic treatment without investigating the underlying biochemical cause would be a failure to diagnose and treat the root of the problem. This neglects the physician's duty to identify and manage disease, potentially leading to progression of the underlying condition and long-term patient harm, a clear violation of the ethical and regulatory obligations to provide comprehensive care. Professional reasoning. When faced with a patient presenting with complex symptoms suggestive of a metabolic disorder, the professional decision-making process should begin with a thorough clinical assessment, including a detailed history and physical examination. This information should then be used to formulate a differential diagnosis, prioritizing conditions based on prevalence and clinical presentation. Subsequently, the physician should select diagnostic tests that are most likely to confirm or refute the leading diagnoses, starting with less invasive and more cost-effective options. This iterative process of hypothesis generation, testing, and refinement, guided by established biochemical principles and clinical guidelines, ensures that patient care is both effective and efficient, adhering to the highest standards of medical practice and regulatory compliance within the United States.